welcome everybody. Again, we're presenting an in-service this afternoon. My name is Carol Wooten, RN. I'm a nurse on 2 Northwest. This is Angie Watkins. She's also an RN and a nurse on 2 Northwest. We're presenting this afternoon an in-service on postpartum preeclampsia. All right, let me get my papers flipped. Our objectives for today are to understand and define postpartum preeclampsia. Recognize the signs and symptoms of postpartum preeclampsia. Be able to identify higher risk patients and risk factors. Be knowledgeable of the treatment for postpartum preeclampsia.
And our agenda is to define and discuss what postpartum preeclampsia is, discuss diagnosis, signs and symptoms, explain possible risk factors, discuss possible complications of postpartum preeclampsia, and discuss treatment options for postpartum preeclampsia.
What is postpartum preeclampsia? Well, we all know that postpartum is having a baby, and then we got preeclampsia, okay? So postpartum preeclampsia is a condition that can happen after childbirth. It is a rare condition that will cause the woman to have a high blood pressure and high levels of protein in her urine. And so what we may see is that they came in with some high blood pressures, but they're continuing to have them afterwards, and that's where you get postpartum preeclampsia. It is a serious condition that can lead to brain damage. It can cause seizures, which is something we try to avoid, stroke. It can go into HELLP syndrome, and death if left untreated, which we would hope that didn't happen. It is related to preeclampsia, a condition that occurs during pregnancy. However, the causes of postpartum preeclampsia and preeclampsia are unknown. Most women with postpartum preeclampsia develop symptoms quickly, usually within 48 hours of childbirth, so they're usually still here in the hospital. It may be that they were still in labor and delivery, or that they've come out to the floor and now all of a sudden they've developed higher blood pressures and they have some protein in their urine. However, sometimes we see our patients go home that did not have any problems during their postpartum period in the hospital, and they can develop it up to 6 weeks out from childbirth. So we try to really warn them of that.
So now we're going to talk about signs and symptoms of postpartum preeclampsia. Some of the signs and symptoms may include high blood pressure, usually over greater than 140/90, high levels of protein in your urine, which is also called proteinuria, a headache, often severe and without relief with pain medication, changes in vision such as blurred vision or seeing spots, swelling of the face, hands, or limbs, nausea, vomiting, abdominal pain, usually on the right upper quadrant, decreased urination, and even rapid weight gain.
Okay, the diagnosis for postpartum preeclampsia, it's usually diagnosed with lab tests. The blood test can determine how well your liver and kidneys are functioning and whether your blood has a normal number of platelets. Urinalysis may be ordered. They may do just a random check for protein, or they may opt to do a 24-hour urine collection to check the protein level.
So now I'm going to talk about the risk factors of postpartum preeclampsia. So obesity contributes to it, high blood pressure, hypertension during pregnancy, a family history of postpartum preeclampsia, being a young mother under the age of 20, or even being an older mother over the age of 40, having twins or multiple babies, and having type 1 or 2 diabetes.
I'm just going to say, in our rural Arkansas, we see a lot of this. We see obesity, we see hypertension, other pre-existing things like diabetes that can affect that. Possible complications of postpartum preeclampsia include postpartum eclampsia with seizures. I didn't say that right. Postpartum eclampsia, which is postpartum preeclampsia with seizures. I was trying to say that all backwards, sorry. Pulmonary edema, which is an excessive amount of fluid in the lungs. A stroke, which is lack of blood supply to the part of the brain. Thromboembolism, which is blockage of a blood vessel that travels from another part of the body. And then we all are familiar with HELP syndrome. It stands for hemolysis, elevated liver enzymes, and low platelet count, and can be very serious. And all of these can be not only very serious, but they can also be life-threatening.
Okay, so now I'm going to discuss treatment. Postpartum preeclampsia may be treated with medications, which include medications to lower the blood pressure, such as antihypertensive medications, labetalol or Procardia, and medications to prevent seizures, such as magnesium sulfate. Can be given for severe signs and symptoms. It's typically taken for over 24 hours with very close monitoring. These medications are generally considered safe for breastfeeding mothers, but check with your healthcare provider. Some doctors will prescribe 81 milligram baby aspirin to be taken daily as a preventative treatment during pregnancy.
All right, and that's all we have. We hope that this has helped y'all understand postpartum preeclampsia. I know we do see it a lot and deal with it. And again, we thank y'all for coming. We do have an evaluation form that y'all need to fill out, and if you'll just stop by and give it to me or Angie before you leave. Thank you so much for coming out.
Thanks.
Bye.